Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Oh, good morning.
That's right. It's good.
Yeah, I'm sorry.
No, we don't never talk about anything we don't let everybody know. That doesn't matter. Okay. Well, we were just enjoying about what we're going to talk about.
It's a great topic. I love it. Talking about, the expecting the unexpected. Suddenly alone. We're going to change the title. So we're going to I hope the author can listen to us because we can follow right through on your next guest. But just before we went on the air, I was saying to you, answering your question, I have patients that live alone and not alone? Yes, I have, but I have a mixture of patients. I have still, husband and wife that are still together for 40, 50, 60 years marriage. I have, and just when we went on the air, I was going to tell you, I have this beautiful couple. They are both very well off. And the gentleman used to like the girl, and he used to look at her at the synagogue all the time, and he used to like her. So once they were younger, when they were younger.
Oh.
When they were younger, before they have family or marriage or anything like that. And he would go to the synagogue and he would look at her. He would love her. He was in love with this lady. So anyway, one day he dared to ask her out to go out for dinner. The person who became her husband also asked her out. And she very naively said, I'm going to go with both of them because we all go to the same synagogue. We're all friends. So she went out with both of them. She ended up marrying the other guy, and then he died, and this other guy's wife also passed away.
Oh, my.
And they got together, finally.
Oh,
So I say, this is such a romantic story. And, I just saw him, and he just, he'd been struggling with skin cancer, and she's so supportive. She's so supportive of him. And it's such a beautiful couple, like, it's not about material thing. This is about companionship. It's all about love. But getting to the topic of being alone, even when you are together, lots of time, depending on what type of relationship, sometimes the woman is the dominant one in the house, and she will do all kind of things that will not inform the spouse, and then she will die, and then the spouse wouldn't know what to do. And when you look in this book that you were telling me about your next guest, people don't set up a path for you to follow. And what happened, we end up losing a lot of money. Because you might have money in the stock market that is doing very well, thank you very much, but nobody knows about it.
And you may have hidden money.
And you may have hidden money. You may invest money with a friend or something like that. And all of this thing is all over. And your significant other, because, you don't talk or you don't set things up so that the person that remain behind can follow through.
It's like your first aid kit almost, isn't it?
Like, exactly. And when I was looking at the book, it sort of gives you some guidance. What's the lawyer that you talked to? Carper?
Yeah. Joe Carper.
Joe Carper. He always trying to help people in the financial aspect. But we don't do that. We think that we're going to live forever. We think it's not going to happen tomorrow.
That's it.
or even today, and you just don't know.
Well, wait, I want to follow up on that, Dr. Mencia. So your patients who come in, if they're optimistic, they feel that way, but I'm sure some of your patients come in and they think they're going to die tomorrow. I mean, they're just negative.
They are negative, but they still don't organize. Some people are negative, regardless of your age. Anita, I tell you that people, regardless of age, your personality and your what we call in psychology, the personal traits that we have, some of them change for the worse. So we might become attention seeker. So we go to the doctor and say, well, I have this cough and my stomach hurt, and all of this, and they sound so sick. And then you examine them, they are fine. You do the electrocardiogram, it's perfect. You do blood test, it's like the best you ever seen. I say, but you are doing well, and you keep digging. You have to trust the patient. You have to believe in the patient. And one of the things that have made me successful is that I don't judge. I'm not here to judge as God. I'm here to listen, to trust you and believe in you, and to take care of you. I had a young patient that came to me yesterday. And, she has a lot of psychiatric issues, young woman. But she was having chest pain. And she described the chest pain, like an elephant sitting on my chest. And it's going down my left arm. And, my father is going to pay for my visit. So I want you to do something. And I cannot come back for a follow-up. I said, you don't have to come back for a follow-up. I'm going to send you to the emergency room. Mm-hmm. No, but I already been to the emergency room. I said, no, you have to describe exactly what you told me. And because she did go to the emergency room, but they sent her home the same day. And they only did a chest x-ray, which means her complaint was not given to the emergency room doctor properly. I said, don't waste your father money. If you go and you are afraid to tell the truth of what's your real complaint, the emergency room doctor is not going to be a magician and get things out of your head. You have to speak up. So regardless of your age, you and I, we did a show on heart disease in women. Yes. They present differently than men. Yes. And I say, a lot of times, because you are a young woman, they're going to write you off and say, oh, it's nothing, it's just your psychiatric issue. No, the only time we can say that with certainty is when you go to the hospital and we draw blood from you every so many hours, and then we prove that your heart is okay. Then we can say we have to now. So I sent her to one of the hospital in Imperial Point that has a emergency room and a psych unit. So that way I said, let them work you up medically and make sure that medically you are okay. Because she already been to 3 emergency room visits over the weekend, including my
goodness.
over a week time. So I say, you need to go in, and this is the complaint you have to give. And then in this hospital, they can also balance your medication for your psychiatric issue. And she was very happy because she said, it's the whole you. I'm treating the whole individual. And she was very happy. They said, yeah, I think that's what I need. Because, the chest pain can be real. But if you already have psychiatric issue, if you have, you are a very nervous person, without being a nervous person, you're going to get nervous if you have chest pain.
Of course.
So imagine a person that is already nervous from baseline. It's going to get worse. It's going to go crazy. So I say, you need to go in and you need to get taken care of more of a holistic way,
Well, I want to tell you a story that happened. One of our sales reps, because it's to do what we're talking about, has had, and I'm not going to mention any names or anything, but has had a sleep apnea for 10 years. And he uses the sleep machine. But he was having more problems during the day breathing. He was tired. So
Is he really using this machine?
Yes, he is using it. But that's why. And he's really a good, very smart guy and all. So he went to the doctor. No, the doctor wanted to put on a halter to test. And he had it over the evening. And in the morning, the doctor called and said, go to the emergency room. And it turned out that they put in a pacemaker.
And that's
now,
why.
but it was his wife, the person who works for me. She's the one that even suggested 10 years ago that he have a PAP. The PAP.
Oh, the
10 years
CPAP.
ago. And I was thinking of bringing it back to Suddenly Alone. See, when you have a spouse or you have someone living with you, it could be a sister, it could be someone else. There's always someone there you can talk to or can observe. Now, what if he was living alone and he didn't have someone to hear him at night, the way he was breathing?
He would have died.
Exactly. So that's
walking around trying to...
Right. So Suddenly Alone, I don't know exactly how people can help themselves with this, but...
Well, you have to prepare yourself. And, in order to do that, the first thing that we need to do is get our head out of the sand. So you cannot live in Florida unless you are passing by for a week or a weekend or 3 months. You cannot live in Florida and not have a house or a place that is prepared for hurricane. Now, in December, you are not going to see any hurricane, or January or February, but there will be season that you're going to have hurricane in Florida. So we have to be prepared. So we have to be prepared if you live with a significant other, that one day you can be suddenly alone. And you need to think of yourself being suddenly alone and your significant other being suddenly alone. It's a two-way thing. Because if you live alone, then you have no problem. You live alone. You just have, if you have kids or you're going to leave your money to a state so that your money go to a charity or something that you decide that's where you want your funding to go when you die. But even if you're going to do that, if you don't put all your money together into a will or something, the only money that can go into the charity is what you have assigned. If you have money in the stock market and you don't add it to this, it's going to stay there. And then it will stay in, to nobody. It will be money for nobody. And
do your patients, though, when they come in, do they divulge a lot of this to you, their worries and their concerns? And do they ever say, I'm afraid, I live alone, what should I do?
They do. Yeah, they do. And in that sense, I'm proud. I'm happy at the same time that my patient can confide in me. And, sometimes they want to talk privately without a significant other being there. And, I have to be, always, even when I have couples like I do, each person become a patient. It's not like, well, I'm a doctor to both of you. I'm not a lawyer, so I don't have the conflict of interest like a lawyer would have and say, well, no, a lawyer cannot do what I do. But I, as a physician, I can talk to the two of them together if they are willing to, and if they want to talk privately, I can talk to them privately. They might have other kids or might have other things that they want to make sure that they get taken care of. And that's, I usually bring the magazine. I say, call Joe Carper. He's a lawyer. He can help you, set up your thing so that this is so important especially when you have more than one family. Some people have been married 2-3 times, right? So they have 2 or 3 family. Because they have offspring with
right.
more than one wife.
Right.
So the last thing you want when you go, when you leave this earth, is for people to be fighting for your money.
Happens all the time, too.
For your belongings. So it's good to set things up, set them up, and whenever possible, assign a family member. Because there are things, sometimes some of the things that I see people fighting for is a painting. And no, I want that painting because my daddy bought it when I graduated from college and blah, blah, blah. And he told me once he was going to give it to me, but there's nothing in writing. So, for those other belongings, those other things. Just take a family member and assign this person will be in charge or distributing whatever else, my family want to share among each other.
I'm going to give you a break for a moment because I want to just tell everybody you're listening to, of course you listen to him every week, but you listen to Dr. Andy Mencia, and the name of his organization that he founded is AGI Medical and Dental Centers.
20 years. Oh
20 years.
20 years.
Oh, well, and you look better than ever.
Thank you.
I can't imagine you look like 20 years. You look so good. Yeah. Okay, so
my manager was saying to me, she doesn't have the mic there, but she was saying to me that Vladimir Putin and Dr. Mencia, they look younger every time.
Yeah, well, I'll take Dr. Mencia any day. Okay.
There you go.
So here we go. Let's, so in Fort Lauderdale, if you want to see him at his main center, it's 1608 East Commercial Boulevard in Fort Lauderdale. And the phone number is 954-489-1345. Now, if you want to see him in Boynton Beach, you can, and they're over on Hagen Ranch Road, and that office, actually, that center was open because you asked for it. You said, listen, I want to see Dr. Mencia, but I don't want to drive all the way down to Commercial Boulevard. So this is the phone number for the Boynton Beach office. Remember, this is Pencil Talk Radio. It's 561-270-6494. And in addition, one of the rare parts about Dr. Mencia's practice is they are open on Saturdays. And that means today, if you're having anything you're worried about, you can actually call, make an appointment, or just drop in, but you have to get there before noon, really. The other thing is homebound patients. And we're going to let Ina, who is the manager, talk about what home visit services, what are they? Who can call? What? Just tell us some of your experiences, Ina, with that.
Anybody who, for whatever reason, can make it to the doctor, either they've been just discharged from the hospital after the surgery, or they just decompensated at home, they had a fall, or the family member can bring them in, or they have a taxing issue, transportation issue, we can send out the doctor or the nurse practitioner to see them. And the appointment, the minute you call, appointment will be set within 48 hours. You will be seen.
That's really important. And also, I think you do dental work there, too, which
is
so unusual.
Yes, and yes, it will, a lot of times when the doctor or the nurse, they go and they do assessment on the patient, and the patient will complain, oh, my God, my denture broke, or whatever the case might be. And I don't really know how to get to dentist. I don't have a dentist for so many years. And they just do a referral to dental department in the office, to Doreen, the dental manager, and we just have a doctor to go and do the work.
Last week, I had one of my dentists do a home visit, and when she was, it was one of our patients that are homebound, and the dentist was telling me, when I see the house, this lady looked like she has such a good life, and she was well off, and she will not go out because of her teeth. She doesn't want people to see her like that. She will refuse to go step outside the house. So when she heard from one of the nurse practitioners that was seeing her, when she heard that we do home visit and the dentist will come to you, she couldn't believe it.
Well, I still can't believe it.
She couldn't believe it, and she was so happy. They were crying in there. Oh, my God, you can really fix my teeth, and then I can go out, and then I can see people. But she will not go out. She will not even go into her condominium
of course not.
To be seen by other residents. There are other people that live in her community. And that's sad, I really, I pat myself on the back when I heard the whole story.
You should.
Because I say, wow, we are really doing something good. We are doing a lot of good in the community. And, we make sure if the patient at any point, if you are homebound and at any point you pick up your strength with what we are doing for you, and you want to go back to your physician of 20 years, you're more than welcome. If you want to stay with us, you are more than welcome. You know, my office is like a menu in a restaurant. You can bypass, yeah, you can bypass the appetizer and go straight for the main course.
Are you the appetizer? I think you're the appetizer.
Go straight for the, you know, you can pick and choose. As a matter of fact, one of the patients that I saw yesterday, he saw me on the hallway, and he said, and he was like waiting there. He was supposed, you know, he was about to leave, and he said, "You are Dr. Mencia?" And I say, yes, I am. So I went and shake his hand and say hello. And he said, you know, I listened to Anita Finley for about 20 years. And when you started coming on the show 5 years ago, and I started listening to you as well. And he said to me yesterday, this happened to me yesterday. I think it was in the afternoon or late morning. Anyway, he said to me, and he's probably listening to us. He said to me, you know, Dr. Mencia, I went to a dentist, and I have some problem, and the amount of money they wanted to charge me and the kind of thing they wanted to do to me, I wasn't sure. You know, I didn't feel comfortable that I needed all of this. So I came to see one of your dentists, and I saw Dr. Lazaro, and I'm so happy because what they told me, what I need is very simple. Because, you know, we do geriatric dentistry.
Yes, that's it.
You know, we do geriatric dentistry. We are not going to take a person, you know, we can take a young person, like, you know, let's say Ina, God forbid, you know, lose a tooth in the front. You know, she's a young, beautiful woman. You know, let's do an implant, let's do something. Let's see what's the best thing we can do for a young, beautiful woman like Ina, because she have a life ahead of her. And she works, and she has to smile. But if you are an elderly person, an implant, maybe a denture snap-on might be a good thing. But, you know, we have to look. I have patients that I see them downstairs, and I look at the bridge, and I say, you have no bridge for implant. So I can send you up there for a free consultation, and then they go upstairs, and they confirm, no, you are not a candidate for implant. You know, because if you are 91, what we're going to start putting cadaver graft in there to build the bridge. It's going to take 3 or 4 years to get you there. So, you know, let's do quality of life. You know,
quality of life.
People age.
That's
so
what you
I was
do.
happy. I was happy that one of our listeners that had been listening to you for, you know, more than 20 years.
That's amazing.
That, you know, he said, let me go and try AGI. And he was happy, and I was happy.
Thank you for coming. That's right. Thank you, wherever you are out there. But I also want to talk about Stonewater Med Spa. I think it's really important because that's something that Dr. Mencia now has taken over, and it's now a med spa. It wasn't a med spa before. So, Ina, what happens at the med spa?
Well, since the holiday season is approaching, we have a lot of specials going on, a lot of packages that people can buy for themselves or for loved ones, gift cards. We will have baskets that you can buy and give it to someone. Nice. Yes, and
tell us what they do there.
Well, we do everything, a little bit of everything, like in the office.
Exactly. Same concept.
So are you the appetizer?
Yes.
If you want to, I can be one.
I'll be an appetizer.
Yeah, so we do massages, we do nails, we do hair. We just got another hairdresser addition to our family.
And the treatment that you got,
the body treatments and the Vichy room.
Yeah, see, that's it. You do some things that nobody else does.
Yeah, so we do facials. And like I said, it's a lot of specials going on in each department.
7 days a week?
We are open 7 days a week.
Yeah, that's almost amazing.
Yes.
7 days a week from when to when?
10 to 8 o'clock. And if we need to stay later, they will stay later.
They come early. They are so accommodating. They are very client-centered.
It's because you're the boss.
Yeah, they are client-centered, and they are very accommodating. You know, people like us, like you and I, that we are so busy. I go and I get my nail done and get my facial.
I saw that
get
on
my
Facebook.
hair. You saw that on Facebook. Get my facial done.
A lot of times, if you like a lot of working people, if they need to be at the spa at 8 o'clock and do their nails, they will be there. They will do it.
So if you are suddenly alone and you need to go and spend time with a bunch of people, there's a lot of people there.
You know what? That's a perfect thing to say. You're suddenly alone, but you can go to places where for maybe an hour or two, you have people with you.
You have people with you.
That's very
that
important.
You know, it's so important that you embrace the people that you know and be open to meeting new people.
Right. That's it.
And
okay.
then you won't be alone anymore.
And so if you want the appetizer, go to
That's
Dr.
right.
Mencia's, the AGI, or go to the Med Spa, and then you get...
You'll get one of those.
Get Inushka Petrushka.
An appetizer. I like this. Anyway, thank you, Dr. Mencia. I'm glad we talked about this because suddenly alone could be anybody. It isn't just
and
an
I hope
older
a lot
adult.
of the listeners stay tuned because it's, you know, we're going to hear from the author themselves.
That's right. So Ken and we're going to do that. Thank you very much, and I will see you again next week.
Thank you, Anita.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.